Good morning. It's July 14th, and this is your daily brief in science. Here's everything you need to know. A recent study reveals that metabolic health, particularly blood sugar levels, is more influential than age or testosterone in the decline of men's sexual health. The research emphasizes that men can maintain or even improve their sexual function through lifestyle changes and medical interventions focused on metabolic health. Findings suggest that good metabolic health is essential for sustaining reproductive health as men age. While testosterone levels are linked to libido, they do not directly affect erectile performance. The study shows that men with blood sugar levels slightly above normal, below the diabetic threshold of 6.5% HbA1c, experience declines in sperm motility and erectile function, even when hormone levels and semen parameters are normal. Even mild increases in blood sugar are associated with impairments in sperm movement and erectile ability. The research followed 117 healthy men aged 18 to 85 over 6 years, out of an initial group of 200, none of whom had diabetes, heart disease, or cancer. The study, part of the FAME 2.0 project, tracked hormonal profiles, semen quality, erectile function, and blood sugar levels over time. Its goal is to help healthcare providers develop strategies for maintaining men's sexual health into older age. The findings highlight the importance of metabolic health management for preserving reproductive function and overall sexual well-being. A recent breakthrough in cancer immunotherapy has demonstrated the potential of inkt-cell therapy in treating advanced solid tumors. A 49-year-old male with metastatic germ cell tumor achieved complete remission after a single infusion of allogeneic iNKT cells, marking the first documented success of this approach in such cases. This patient had undergone multiple treatments over 2 years, including chemotherapy and immunotherapy, with limited options remaining. The infusion used an off-the-shelf product called inkt-797, which led to significant tumor reduction and sustained remission. Post-treatment monitoring showed increased interferon gamma levels, indicating activation of iNKT cells, while cytokine levels stayed stable, suggesting a favorable safety profile. iNKT cells are known to enhance immune responses by directly killing tumor cells and modifying the tumor microenvironment to support anti-tumor activity. Their ability to stimulate both innate and adaptive immunity highlights their potential as a powerful tool against various cancers. Since these cells are developed as an allogeneic, off-the-shelf therapy, they do not require HLA matching or prior lymphodepletion. The patient's treatment remained active for 6 months without severe adverse effects like graft versus host disease or cytokine release syndrome. This case supports further research, including clinical trials, to evaluate iNKT cell therapy in other solid tumors and to explore engineering these cells with tumor-specific receptors. The findings underscore the importance of ongoing studies to assess response durability and broader applicability of this treatment approach. Targeting a specific protein called galectin-1 could improve treatment outcomes for early-stage liver cancer. Research from UCLA's Janssen Comprehensive Cancer Center shows that galectin-1 helps cancer cells resist heat-based treatments like thermal ablation. It does this by boosting sugar metabolism, which increases energy production in cancer cells. This energy allows the cells to survive the heat and grow faster afterward. Disrupting galectin-1's function may enhance the effectiveness of treatments across all stages of liver cancer. Scientists used genetically modified cell cultures and mouse models to test this, finding that inhibiting galectin-1 reduced tumor size and energy production when combined with thermal ablation. Patient samples and animal studies confirmed galectin-1's role in supporting cancer cell survival under heat stress. A combined approach using thermal ablation and the galectin-1 inhibitor OTX-008 led to a 2-fold reduction in tumor size in mice. Up to 40% of liver cancer patients experience recurrence after ablation, often at the tumor edges where heat is less effective. Galectin-1 appears to facilitate the survival of these resistant cells, contributing to tumor regrowth. Dr. Jason Chang, the senior author of the study, explained that galectin-1 fuels cancer cells, helping them recover quickly after treatment. Analysis of biopsy samples from 58 patients showed higher galectin-1 levels in tumors that recurred rapidly, indicating a link between galectin-1 overproduction and quick recurrence. The findings suggest that using galectin-1 inhibitors like OTX-008 could enhance the success of thermal ablation and reduce the risk of cancer returning. Introducing allergenic foods early in infancy can significantly reduce the risk of developing severe food allergies. A recent study published in the Journal of Allergy and Clinical Immunology in practice examined over 1,000 children to evaluate the impact of early allergen introduction. The research supports updated guidelines from the Australasian Society of Clinical Immunology and Allergy, which now recommend introducing peanuts and eggs around 6 months of age. Previously, the advice was to delay such foods until after 1 year. The study compared children born before and after these guidelines changed, showing a marked decrease in allergy rates among those introduced to allergens early. Egg allergies dropped from 12% to 3%, and peanut allergies from 6% to 1% in the group following the new approach. However, the study only assessed allergies up to 1 year of age, so long-term effects remain to be seen. Experts stress the importance of increasing awareness and ensuring health professionals communicate these updated recommendations effectively. Many parents, especially those with a family history of allergies, remain uncertain about when to introduce potential allergens. The 6-month introduction strategy has now been incorporated into official guidelines, marking a shift in infant feeding practices. While cow's milk was also studied, the reduction in allergy prevalence was less significant compared to eggs and peanuts. Scientists have identified the oldest known pigment, preserved for over 1 billion years in ancient cyanobacteria from Mauritania's Taoudeni Basin. This discovery pushes back the timeline of pigment existence by approximately 600 million years beyond previous records. The pigment was identified by graduate student Noor Gwynelli, who observed it turn bright pink when exposed to an organic solvent, indicating fossilized chlorophyll from blue-green algae. Senior researcher Jochen Brox compared the significance of this find to discovering dinosaur skin that still retains its original colors, highlighting its importance for understanding Earth's early history. The discovery raises questions about the environmental conditions that delayed the emergence of complex life, despite the oxygen produced by cyanobacteria. Findings suggest that, although cyanobacteria dominated ancient oceans, their proliferation may have created an evolutionary bottleneck. This bottleneck could have impacted the development of more complex organisms on Earth. The discovery provides new insights into early life and Earth's atmospheric evolution, opening avenues for further research into the conditions of the planet's distant past. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.